Welcome to Learning Anatomy with Dr. Bakari. If you are visiting this channel for the first time, you are also highly welcome. In this lecture, we'll be looking at the histology of the blood vessels, and would also be relating the histological presentation to what they look like in gross configuration and also the functions that they perform. So when a section of the blood vessel is extracted and processed into histological section, this is the kind of configuration that you see up here. The wall of the blood vessels is subdivided into tunics, which are histological layers that the blood vessels present. So we have 3 layers of tunics, and this includes the tunica intima. From the name tunica intima, it means it is the innermost layer and it is the inner lining of the blood vessel. And this is what is presented in this image up here. You can see the region that is captured in black. It is the innermost region of the wall of the blood vessel. This is the central compartment, which is also referred to as the lumen. This is the space through which blood will flow through. The most internal layer that is seen to bound the circumference of the lumen is the tunica intima, and this is the region here. And what this region is made up of is the endothelia and also the subendothelial layer. So this is further subdivided into 2 sublayers. If you try to use this image down here for illustration, this is the region that is captured as the tunica intima. You can see that it is further subdivided into the endothelium and also the subendothelium. So for the endothelial layer, it is made up of squamous epithelium that is seen to be aligned on the basement membrane. And this is the region here highlighted in black. These are simple squamous epithelium. So why do we have simple squamous epithelium lining the interiors of the blood vessels? We can also justify this because we know that exchange occurs within the wall of the blood vessels, and we do not need epithelium that are seen to be thick. And that is why we have the tiniest form of epithelium lining, which is a simple squamous type of epithelium, which means that it's a single layer of flat epithelial cells. And that is what is seen to line the interior wall of the blood vessel. So we have simple squamous type of epithelium that is seen to line on the basement membrane. And the second subdivision is the subendothelial layer, and this is the subendothelial layer that is highlighted here. This layer is seen to help hold the endothelial layer in place. As we know, it is the sub, which means it is seen below the endothelial layer. And what it does is to help give a structural support of the endothelial layer. And the second region that is seen in the histological presentation of blood vessel is the tunica media. From the name, tunica media, it means it is at the middle, and this is made up of smooth muscle layer. So this is the tunica media demarcated here in red in this upper image. When you go deep to the tunica intima, the next region that will be seen on the outside or more superficial to that region is the tunica media, and this is the region here captured in red. This layer is made up of smooth muscle, and we know that smooth muscle will undergo contraction and relaxation, and as they do this, they are helping to push what is contained within the lumen of the blood vessel along it. So they help to drive the blood in one direction, pushing it to the region or organs in the body where they're supposed to feed with oxygen and also nutrients. If you use this image down here, we see that this region also captured in black is the tunica media. It is the middle layer, as we've said. We see the central region, which is made up of smooth muscle, and this is highlighted in green. On both the inner region and also the outer region of the smooth muscle layer, we have the elastic lamina, and this is the elastic lamina on the inside, and this is also referred to the internal elastic lamina. Then we have also elastic lamina on the outside, which is referred to as the external elastic lamina. So that's the way the tunica media is configured. You see the region that is deposited with smooth muscle, and you see it bounded both on the inside and on the outside by the elastic lamina layer. And that is what is seen at the central portion of the blood vessels when processed into histological section. Then more external, we have the tunica externa. Just as the name implies, this is also referred to as the tunica adventitial layer. If you look at this image up here, this is the region that is captured in white. It is the most external layer of the blood vessel when processed into histological section. So this is what you see. So if you try to take this image down here, this is the tunica externa or the tunica adventitia layer. It is highlighted here in black. And what is seen is that it is made up of this irregular connective tissue. And this region is what is responsible for anchoring these blood vessels to the organs. Because we have said that what vessels do is that they carry blood to and fro different organs in the body. And of course, they are going to be having relation with the different body organs. So it is through this tunica adventitia layer that they are able to anchor themselves onto the organs that they are supplying. This is the tunica adventitia layer highlighted in black. If you look within the tunica adventitia layer, you see that we have tiny blood vessels, and these are the blood vessels. This is another one in this region. So these tiny blood vessels also supply the wall of this vessel with also oxygen and nutrients. We also have nerves, and the region where they are embedded is the tunica adventitia layer. So these are all the three subdivisions of the blood vessels when processed into histological section. You can see how interesting this is. So let's go further to now highlight the differences between the histological presentation of the arteries and also the veins, because there are also some differences in their microscopic presentation. The differences are centered around the lumen and also the thickness of the different histological subdivisions of the blood vessels. So let's drive through this to see what this presents. This is the artery and this is the vein. If you look at the configuration of the artery, let's start with the lumen. In the artery, the lumen is smaller, and it is also well aligned. If you look at the circumference of the lumen, you see that it is not collapsed. It is well aligned. And this is because of the thickness of the tunica media. If you look at the tunica media in the artery, this is the region of the tunica media that we've highlighted, the region that is highlighted in green here, also supported by the elastic laminar layer on the inside and also on the outside. So if you look at this central portion for the artery, this middle muscular layer that is also referred to as the tunica media, you see that it is thick, and this also helps to reinforce the circumference of the lumen, and that is why they are well aligned. They are not collapsed. If you look at the veins, this is the lumen of the vein. You see that the lumen is collapsed here as a result of the reduction in the thickness of the tunica media. This is the tunica media here highlighted in green, also supported by the elastic laminar layer on the inside and also on the outside. If you look at the thickness of the tunica media here, you see that it is not as thick as what is presented in the artery. And that is why we have the collapse of the lumen of the veins. And you see that they are not well aligned here. And this can be used to justify the collapsed nature or presentation of the lumen of the vein, because the tunica media in the vein is not as thick as what is presented in the artery. So there is no form of structural support that is given to the lumen for it to be well aligned. So it is seen to be collapsed. If you look at the tunica media, which is the central middle muscular region, this is the region here in the artery highlighted in green, you see that it is thicker in the artery. For the tunica media in the vein, which is made up of smooth muscle, you see that it is thinner. So it is not as thick as what is presented in the artery. Also, if you look at the elastic laminar layer that helps to bound the muscular layer on the inside and also on the outside, you see that for the artery, it is also thick. If you look at the internal elastic lamina, it is thick. The external elastic lamina is also thick for the artery. In the vein, the internal elastic lamina is thin. The external elastic lamina is thin. So you see that the entire configuration of the tunica media in the vein is not as thick as what is presented in the artery. And this can also be used to justify the collapse of the wall of the vein. If you look at the tunica adventitia layer, which is the tunica externa, on the outside, this is the region highlighted in black here. You see that for the artery, it is not as thick as what is presented in a vein. In the vein, it is thick. So that is the basic difference that is seen between the histological presentation of the artery and also the vein. When you talk about the layers that are seen in the microscopic presentation when processed into histological section, you see that some of the layers are thicker in the artery than in the vein, while some are thicker in the vein than in the artery. And this we've tried to establish. Also to add, we have some arteries that are called the elastic arteries, and we have some arteries that are called the muscular arteries. For the elastic arteries, it means that the configuration or the deposit of the elastic lamina will be more. So if you take a section of elastic artery and process into its logical section, you see that the elastic lamina will be thicker than what is presented in the general configuration of arteries, and those are called the elastic arteries. These elastic arteries are large arteries, and these include the aorta or the carotid artery. These arteries are more intense in the function of driving high pressured blood because they are large and they need to give supply to their subdivisions. And also, if you look at muscular arteries, the muscular arteries are smaller, and they include the femoral artery or the radial artery. These arteries are muscular because the deposit of smooth muscle within the tunica media is more than what is presented in the general configuration of histological presentation of arteries. So that is just the basic difference. When you try to process these arteries into histological section, you should take note of the thickness of the tunica media. And this you can use to establish or deduce the kind of artery that you have processed. And if we try to relate the histology with the gross presentation and also the functions that the arteries and the veins perform, if you remember a lecture on the arteries versus the veins, we tried to establish that in the artery, blood flow under high pressure. And for blood to flow under high pressure, it needs a strong momentum to be able to drive that. And if you look at the configuration or the histological presentation of the artery, you see that the tunica media, which is the region here highlighted in green, and also banded with the elastic laminar layer on the inside and also on the outside, is thicker than what is presented in the vein. So this thickness is what provides the momentum to be able to drive or to push the blood flow within the artery under high pressure. So let's try and relate this to clinical application. And the first one I want to relate histological presentation of arteries is aneurysm. Aneurysm basically is the bulging of blood vessels, and this is due to weakening of the wall. And of course, if this is severe, it can tend to rupture and result into bleeding. This is attributed to loss of elasticity. This is aneurysm. This is the blood vessel, and you see like a bulge that is seen on the wall of the blood vessels. So if we try to link this defect or abnormality to the histological presentation of the arterial wall, we see that the target will be the tunica media. This is the tunica media that we previously described in our previous slide, that it is made up of smooth muscle bounded on the inside and also on the outside by elastic lamina. So when there is loss of elasticity within the tunica media, there's going to be the bulging or the expansion of the arterial wall. This is the circle of Willis, and this is where we have the bulge created. And we have said that if this rupture, it could be very dangerous because it will lead to bleeding. So the next application that we want to use the histological presentation of vessel to establish is obstruction or stenosis. This is the blockage of the lumen of the vessel. So if you look at this image here, harrowed in yellow, this is a deposit that is seen within the internal wall of the blood vessel. And remember when we tried to establish the histological presentation, we said that this central portion is the lumen, and it is through this channel that blood passes through to be able to supply different organs in the body. So if there are deposits seen in the internal wall, which is the lumen, there's going to be the reduction of this space. And if there's reduction in this space, it means that the quantity of blood that will be passing through it will be reduced. You can also use histological evaluation also to deduce obstruction and also stenosis. So thanks for watching. Let's meet again.